Hello and welcome. Thank you for joining us today. My name is Eli Soto. I am the chair of the Pheo Alliance. Not only am I a volunteer, but I was also a patient. I had my own bout with metastatic pheochromocytoma for several years until it was finally discovered and taken out. It's a long process and journey and quite the ordeal, but I'm happy to be here and help other patients like me. There's many aspects that we cover throughout some of these webinars. And today I'm pleased to bring with you Jeffrey Rodriguez, who I'll give a proper introduction to here in a few minutes. This program is brought to you by the Pheo Alliance, whose mission is to empower patients with pheochromocytoma or ganglioma, their families and medical professionals through advocacy, education, and a global community of support while helping to advance research that accelerates treatments and cures. And we'd like to give a special thanks to Progenics for making this webinar series possible. In fact, all of these webinar series have been thanks to Progenics, and without it, we wouldn't be able to give the patients the information that they need. So thank you very much. A little bit of housekeeping items. We have some upcoming events. April 5th, we have an online peer support meeting. These are great for when people are first being discovered with pheochromocytoma. They can join these and kind of just get information from people that are going through the same journey like them. On April 14th, we have a precision surgery webinar. And then there's links for all of these events on our website at pheopara.org. So a little bit to the agenda today. We're going to have Jeffrey present for about 30 minutes, and then we're going to do some Q&A from the community. We ask that the questions be submitted beforehand, and you can also type your questions into the chat section, and we'll do our best to have all of your questions answered if time allows. Many of these questions are going to be duplicates, so we'll try to filter out anything that's redundant, so that way we can get to the heart of the answer that you guys need. We ask that the questions also be less case-specific, if possible, so that way we can just answer in a broad general term. The contents of this is for educational purpose only. So now, if I may, I'd like to introduce Jeffrey. Jeffrey has been with the Social Security Administration for over 12 years, serving as a public affairs specialist in San Diego and Orange County for the last 7 years. He serves as a windfall elimination provision and government pension offset trainer for the San Francisco region in the South Coast area. He was a specialist assigned to Medicare non-utilization project and a member of the South Coast Area Representation Payee Review Task Force. Jeffrey hosts a weekly local television show called Social Security Today, which covers Social Security programs, rules, as well as keeping viewers informed on Social Security issues. Jeffrey is a member of the San Francisco Regional Management Association, as well as a Hispanic Affairs Advisory Council. So with that, I'd like to turn it over to Jeffrey.
Thank you, Eli. I appreciate that and appreciate the opportunity to be with you all today to present some very important Social Security information. So this is part 2, if you didn't see the first part, which covers specifically disability and those that have paid into the entitlement, or what we call a Title II benefit, which is someone who has paid in, is currently insured, and potentially eligible to a disability benefit. Today, we want to cover SSI, or Supplemental Security Income. So allow me to share my slides and we'll go through the information. Supplemental Security Income, and specifically to disability, or SSDI. Supplemental Security Income is a federal program which is really a needs-based program. And so when individuals take a look at this, what we're really considering is those that have a limited income as well as resource. And we'll identify that a little bit more in just a few slides here. But who is it intended for? The overall program itself covers 2 different types of individuals. The first, as listed there, individuals that are age 65 or older, and then any of those individuals that have a disability. And as I said in the first part, have some type of limited income and resources. So we'll develop all of that as we go through. And this is significant because really what happens is individuals don't really understand how SSI works or understand the program itself, and some don't even know that it exists. Usually, when you think of Social Security, an individual think of retirement. They may potentially think of the survivor benefit. Um, some will understand that there's disability, but very few understand SSI or know that it is a Social Security program that we administrate. So let's walk through and talk about SSI. So, as I said, there's really kind of two individuals that we're looking for. Both have to be within that limited income and limited resources in order to be eligible or potentially. And I'll kind of use that word potentially eligible because we still have to go through and determine all of the other factors. But we'll cover the principal or primary factors that an individual should be aware of when they are considering or to see kind of pre screen themselves. And even if they're doing that, I would still say an individual should apply for the benefit. Let Social Security, let our claims representatives do their job and review the information and make that determination rather than yourself, because you potentially could be, missing out on a benefit that you're eligible to. So besides the limited income and resources, there's two sets of individuals we're looking at. Again, those that are over age 65. The other is those with a disability. Now, what we're looking at when we say a disability, and we covered this in part one, but I want to reiterate once again, the disability is going to fall under those same guidelines. It has to be a disability that is expected to last at least 1 year, 12 months or more. And generally, we're looking for those that will disabilities that we know the individual is going to take either a great length of time to recover from, or potentially will not recover from, and also may result in death. Those are the disabilities that we are considering. Now, there is a whole listing, and I'll share where you can go within our website to look at those. But just kind of keep that in mind that we're looking for those disabilities. Now, have to be under the Social Security Act or law to be included in those. And the reason I say individuals should still apply for the benefit is because those listings are updated and there's new listings that are continually being added and expanded as far as the parameters of some of those disabilities. And so there's no real way to say, hey, it's always this way and it's always going to remain that way. They change, they expand. We find new types of disabilities, such as being with this group. Many probably have no idea, but you all are aware of it. So there's these types of things that exist out there, mental as well, disabilities as that field expands. And so those are also added to and change the listings on our side and the parameters. Now, there is listings for an adult when it comes to disability and different listings for minors or children. All right, so let's start with the youngest, which would be for children. Who's considered a child when we're looking at SSI? So it's going to be those that are under age 18. We're looking at obviously minors here, and each of the different age groups, if we were to break it down, which I'm not going to go into that depth today, but for every age segment, there are different parameters and disability listings for each of those. So an infant, a child that is born, if it's premature, has a certain listing. What is for the weight and for the size of the child and so forth. And so each of those age categories have a various listing that would affect. And so therefore, that's why I say always apply. If you are unsure, apply and allow us and let the system process and determine. And what we're looking at really between age 18 and 22 is if an individual can be apply and be found approved for a disability prior to the age of 22, then they remain a child with disabilities even as an adult. So we call them an adult child with disabilities or childhood disabilities, making them eligible on a parent record later on. So there's some uniqueness to that. So that's kind of why the age 22. So it kind of expands up to, and for children with disabilities, depending on their educational level, between that age 18 and 22. But we want to reestablish at age 18 for all of those individuals anyway. Now, some of those requirements, as I said, under age 18, we're looking for that the limitation on function, meaning an individual's ability, what they can do. So it's not to, whether it's a physical or mental impairment, not able to function as required, really, or that normal average that has been established. And so we're looking for those children. And the same, really, when we start to get into the adult, it's very similar that what the key to the disability is the limiting function. What is the individual able to do? And as stated earlier, the condition has to last 12 months or more or result in death. So we're looking for those severe disabilities because this is a lifetime type of benefit, meaning from when we find you, it's normally disabilities that the individual is not going to recover. Now, some do, and there's a whole process for an individual to return to that normal, so to speak, lifestyle without the disability providing some of those challenges or barriers in their life. But really, we're looking for those disabilities, and the listings kind of lend or lean towards that it'll be very difficult, or it'll take a long time for the individual to recover from that. Continued, and when we talk about requirements for children, we're looking at households where we have to consider the parents, and we do, for those children, what is called deeming. So the child can have, and is going to need some of that support from the parents, obviously financially, living within the home. But we look at that, and the deeming process is such that we take a parent and whatever other children, meaning in the household, that their resources, their income would go to first, and then any remaining portion then is applied to the child with a disability. So, dependent on the family scenario, uh, it could be that the parents work and are able to provide for the rest of the family. But when we do the deeming process to determine how much of that income and resource will be counted for the child with the disability, then and that process at the end will determine and say, okay, well, this is how much will be left over and still allows that child with the disability to potentially be eligible. Or we look and say, well, they're going to be over income. The parents' income have enough to resources or income to cover not only the other family members within the household, but also that child. And what we consider a household would be, kind of a term that's brought over from a very similar program where SSI is a monetary benefit. The SNAP, or what used to be called food stamps, now SNAP, this nutritional program, is providing that food. So they're very similar. And so we call it purchasing and preparing, meaning who it really is sharing the living expenses together. Not so much are you under the same roof, but who shares with who. And that's how we determine that deeming within a family. So it may even be two families under the same house in the same home, but only one family in their income goes towards that family, and then the remaining would go to the child, not the overall household. So it could be a family living with grandparents, and grandparents are separate, and we're only looking at the parents and the children. Now let's turn the corner here and start talking about the SSI/DI, or Supplemental Security Income for Disability for adults. So now we're looking at, once that child turns 18, we're able to make a determination for that child individually or to exclude everything from the parents. So no deeming at that point. And this is where if a child has a disability and maybe was not eligible during well under age 18, and so maybe age 15, 16, they come across a disability, and now they're still living at home. So we have to look at the parents. We have to look at all of that, but we can look at now the child by themselves due to their age. So that's really the turning point where we say now if anybody from age 18 and above can be considered by themselves. So if the disability keeps the individual from working, then there's the limited income. And if they have no other type of income, then definitely still meet that qualification. And if they have not amassed or have no other resource, they don't have a bank account, they didn't previously work and have a 401k that they could access or anything of that nature, or inheritance that is sitting for or waiting for them, then and all these other things, then that individual we can look at and may potentially be eligible. Now, the Social Security Act defines a disability very clearly, and I'll just read this to make sure that we're capturing it. A person who cannot work. Now, it doesn't specify there what type of work. So, if an individual is educated and has a certain skill set and says, "Well, I was a plumber, or I was an electrician, or I was an accountant, a lawyer, whatever it may be," and now due to my medical condition I can't work in that capacity. That's not what we're indicating here. The Social Security acts as a person who cannot work due to a severe medical condition that has lasted or expected to last at least 1 year, 12 months, or result in death. And I'll get to the second part right now. So that individual, then, when we say cannot work, again, it's not in that specific area that they are normally used to or have been educated, have a skill set for. It's any type of work. That's what we're looking for. And the second part kind of explains that. The person's medical condition must prevent him or her from doing substantial gainful employment, work that he or she did in the past, and it must prevent the person from adjusting to other work. So their income has now gone down because of the work that they are able to do, or the limitations of the work that they are able to do would go below this substantial gainful employment. And we're going to touch on some of what those limits are later, but just introducing to the terms and the conditions of, or as we define it, the disability. So as we move on, so what to consider, what do we need to look at? So as stated, in I don't mean to sound like a broken record, but I want to make sure that you understand that supplemental security income is a needs-based program. So we're looking at income, and it can be any type of funds, any type of monies that are received, whether it be what we call unearned or earned. Unearned meaning gifts or grants of any type of sort, monies that are received, or earned, which would be the income side. I work for it and therefore I receive this. And income can also what we call in kind, in hyphen kind. In kind income could be where someone is paying and providing food and shelter for the individual. The other would be the resources, and those are the limited types. Anything that's liquid, that's what we're really looking at there. Something that is liquid, and we'll get into a little bit again to develop those a little while here in a couple of screens further. The key thing with SSI, very different from an entitlement. So when we did the disability, the Title II, where you're currently insured, paid into the Social Security system through your work, and now you have this disability, unable to work, and you become eligible to Social Security disability, you can live wherever you want. It's an entitlement. You're eligible or entitled to that benefit. SSI is a needs-based program, and therefore there are certain conditions that we have put on that. And one of the main ones that's now being introduced into the conversation here is that the individual has to live within the United States. So it can't be, Southern California, we live close to the border. It'd be less expensive for me, and maybe even medical contention I can get down in Mexico. So I'm going to cross the border and live down there. Well, if you do that, then you are not eligible for SSI. Now, if you have the disability, you could do that. You're allowed to do that, but not SSI. You have to live within the US or some of those territories, islands that are identified as part of the United States. Uh, if the individual is not a US citizen, then they have to be lawfully residing in the US. And in order to be eligible to SSI, they're going to have to show, or between themselves and if they're married, if it's a couple together, they have to have 40 credits, meaning in layman terms, or working it out, what that really means to describe that would be they would have had to work about 10 years worth of work paid into Social Security. You get 4 credits maximum per year. Right now, the credits are about 1,000. I believe it's 1,300. So after close to roughly, I'm going to say about $6,000 that you earn and pay into Social Security tax, then you would get your maximum 4 credits in the current year. Once you have those credits, then you can't earn any more, maximum 4. But after 10 years of the 40 credits, that would make an individual potentially eligible to SSI through the disability or through the age 65 if they are not a citizen. Once they become a US citizen, they are automatically ineligible. They are eligible to potentially eligible to the SSI and under this program. And that's important to understand. So when we say income, I mentioned this earlier, earned versus unearned. Earned income would be wages, W-2, self-employment, that type, right? And that's how we consider that earned. Unearned would then be those types of income that you just received. It could be another type of benefit as listed here. It can be from any source that's coming to you directly. So it could be grants, it could be aid from an organization or an individual, whether that's a family friend or not, but you're receiving this income from them. Then we have to count that. Unearned income is counted directly against the benefit that is paid, which is around $900 currently. We're in March 31st, 2022. So I'm using numbers for this current year. And so when we look at that, we say, okay, unearned, if you have under 900, so maybe an individual gets $600-700 of benefits from some source, they still are potentially eligible. They meet the income requirement there. If they're working, there are some exclusions, so the individual can work and earn a little bit over that amount. But in a sense, that's how SSI works. When we're talking resources, and at the bottom there, you're going to see of the slide, it says that individuals can have a resource limit of 2,000, and as a couple, 3,000. So as long as the resources are below those limits, 2,000 for an individual, 3,000 for a couple, then they could meet that requirement. If they have any type of the included bank accounts, bonds, stocks, 401k savings programs through work, any of those, we're going to look at, and those are going to be included, and we have to count them because they're liquid. You have access to them. Even if you have a penalty that you may have to pay for a 401k or an IRA that you have to take out early, it's still accessible. There's just a fee that one would have to pay a penalty, but that's not what we're looking. We're looking at, do you have access to it right now? And the answer would be yes. So that's included. Excluded resources would be you can own a home as long as you live in it. If you own the home and you're renting it out and you don't live there, that would then be included, and we'd have to take that home into consideration. But if you have a house that you are living in, it's your home, that can be excluded. One car, the first car is excluded. Now, if you have 2 or 3 cars, then we have to look at the value of those cars. Do you owe anything? Are you still paying those off? If not, if they are complete, then we have to count those included, right? Whatever value is left over from what you owe and the value of the vehicle is going to be included. And, especially nowadays, as used vehicles have a greater value. But if the individual only has one vehicle, no problem. Doesn't matter what type. You could have a luxury sports car, an expensive vehicle that was given to you, it's paid off, we're not going to count it. Burial plots, as you see there, some other types of resources, specific funds or trust funds that we'll get into. I'll touch in a little bit. So there are resources that can be excluded. It's not everything. So it's not, things that you use, your clothing, your furniture at home. No, 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 no. We're looking for resources that you can tap into, that are liquid, that you don't have to go liquidate in the sense of sell to get money. So that's what we're looking at for that 2,000 as an individual, 3,000 for a couple. Now, living arrangements, and I mentioned this before, that who's together, who is the family, who's the component, the household that we're looking at, and that would fall under living arrangements. So it's anyone that is in the household is those that are combining their incomes or their monies, their funds, in order for living, to pay housing, to pay utilities, to pay food, all of those. That's who we're looking for, and that would constitute a household. And so as someone moves into a different living arrangement, renting a room. Okay, well, we're not looking at the other individuals. You're by yourself. You're going to purchase your own food. You're going to prepare your own food separately. You have a space in the fridge that's for your food only. Okay, that's your separate living arrangement, or household, as we would call it. So we're looking at those. Now, if the individual is in an institution where everything's provided, then the benefit for SSI is only $30, because everything else is provided, the housing, the food at that institution, and whatever it may be. We're talking like a rehabilitation program that you have to go through, and you're living there. Everything's taken care of. So therefore, the benefit will only pay out at $30. Um, if not, if it's you are just living at a place and you have to pay for everything, then that's counted differently, such as in group care or board facilities. And when we look at the specifics of those to create what under the living arrangements would be. Now, this is where it gets difficult for individuals that have certain challenges and disabilities, because the reporting responsibilities here under SSI, it's very unique in that this is a month to month program, meaning that we require that any changes from that have existed within a given month, you need to report those within the first 10 days after that month has ended. So let's utilize today. Today's the last day of March. So March 31st, today ends. Tomorrow, I would need to report within 10 days of April. I need to report any changes I had. I started working. My income went up. My income went down. I moved to a different location. I'm living in a different house. I bought a car. I sold my car. Whatever those changes are, they need to be reported so that we can review them and see how do they impact your benefits. So March, I report in April. We then do the budget or figure out the benefits due to the individual by that reporting that is provided. And if there's no change, then there's no reporting in April. And then in May, we pay what was reported about March. So March gets reported in April, and then May becomes the benefit or payment month for March. And so there's always this 3 month, month 1, 2, and 3, that are rolling. The month that something that occurred that you're reporting on in the following month, and then the payment month for that month 1. And that's how that goes. So it's really important that individuals do this. It becomes a little cumbersome for certain individuals, because usually certain individuals with certain challenges or barriers are moving quite often, or maybe changing jobs, or their hours that they're able to work fluctuate. They're only able to work a few here and there, and the income fluctuates a lot. Well, all that needs to be reported, and so that can become difficult and cumbersome for the individuals, unfortunately, and we see that. Now, some of the other related information as we kind of look at SSI that I briefly want to go through, and then we'll have a chance to ask some of the questions. SSDI, which would be the benefit that the individual is entitled to in disability, versus SSI. So the left side is entitlement. I paid into Social Security. I'm entitled to this. The right side would be SSI, a needs-based program. So they're very different because the payments in the entitlement come from the trust fund, from where individuals pay Social Security tax, and that's kept. On the SSI side, that is from the general treasury. It is not out of the trust fund. That comes from a separate location. So when individuals say, well, individuals that are getting SSI are chewing up all my money, that's not how that works when we talk about solvency. Solvency is related only to entitlement. SSI is separate. Um, the entitlement, people work and pay into it. The SSI is a needs-based program that is assistance at a federal level. Social Security just happens to administrate this program. And those types of changes, and you can see there, and you can read maybe one that affects where your scenario, or just the differences. So you can see there are some marketable, or changes, differences between the two. Now, this is probably one of the best. I don't want to say kept secrets, but it's a gem that you kind of have to hunt for, or if you don't know about it, you won't find it. For individuals that are considering SSI, or have applied to SSI, or receiving SSI, the SSI Spotlights is a fantastic page within our website. If you go to the search engine and just put in SSI Spotlights, it should come up. And what this does is, right where that little light is shining, right above it, it says Go to Spotlights. One would click on that, and it takes you in, and it gives the ability for the individual to say, okay, I want to know about resources. How does it exactly? And then there is a very well-defined, descriptive um, uh, portion of information that's available under that listing for someone to read and take a look at. Maybe you want to know a little bit more about income, or resources, or trust funds, or living arrangements, whatever under the SSI that can be affected. You can read and find certain links and get in-depth, detailed definitions for each of those. Now, I use SSI Spotlights excessively, simply because it's you find all of the information you need, very well defined. It's a great tool. So if you find yourself applying or considering, and you want to look at some of those topics under the SSI, well, what does that really mean? I have maybe this type of resource. You can see if it's listed there, whether it would be counted or excluded. So a lot of great information on SSI Spotlights, not just for those prior to considering the benefit or applying for, but especially those who start receiving it and getting clarification, to help them know what I need to report, maybe how the benefit works itself. Now, there's two types of medical provisions that are administered under Social Security. The first, Medicare, as listed there, is for those individuals that have paid into the program and become eligible because they have reached the age 65 or older, or have a disability through entitlement that is at least has lasted 24 consecutive months. So after 24 months, 2 years of disability, Social Security disability, entitled, remember, paid into. If they have disability insurance, then after 24 months, they can have Medicare. So that is for those individuals that are age 65 or older, or have that disability. SSI is a little different. When an individual becomes eligible to SSI, immediately they are eligible to Medicaid, or in the state of California, Medi-Cal. And that is a great program for that. A lot of individuals at times aren't even looking for the monetary benefit in SSI. They're looking for the Medi-Cal. They're looking to receive that benefit there. So I find that interesting that people will apply, and they're not really looking to see how much they're going to get, and maybe they'll get very low. They maybe have some other funds or whatever it may be, income, that's going to have their benefit be low, but the the substantial portion is that they're looking for Medi-Cal because it pays more on the medical provider side. It provides more or covers more, and especially if an individual can be under Medicare and Medi-Cal, both what they call Medi is very powerful because that means most everything's going to be covered. Usually, whatever the Medicare doesn't cover, Medicaid or Medi-Cal will cover. So if you hear those terms, that's what they're talking about. A lot of people get those two terms mixed up, the Medicaid and the Medicare. They sound so similar. Again, Medicare is for those individuals that have paid into the system, have a disability after 2 years, or reach age 65. So the differences or kind of those numbers we talked about: substantial gainful activity, someone who's working, has a disability. That would be if an individual is earning more than 1,350 per month, then they're not going to be eligible to the disability, to Social Security disability. For a blind individual, it goes up to 2260, so a little higher, which means an individual can have a disability and work and still be eligible. Now, I'm not going into the trial work periods, but what that's saying is that if your income goes beyond above 970 as you become eligible to disability, we give this period of time where you still receive your benefit. But if you end up going over 9 months, then at that point we move into an extended period of eligibility to say you might be eligible to the benefit or not, depending on how much income you have each month. And then after 3 years or 36 months, then the disability could stop. And that's under the entitlement disability. SSI is month to month. So it really is about if you have income and resources. If you are below the thresholds, then you're eligible. If you're above, then you're not going to be eligible. And that's ongoing until the point where we say, okay, well, you haven't renewed or you're unable to, the disability has gone away, or your income or your resources are too high, you're no longer eligible. And that, again, happens much more quickly with SSI because it is a month-to-month program. I'm not going to go into these. These go really deeply into the Medicare side because I'd put together both a Medicare and, or rather, a disability and SSI kind of separate. And so they cover under both. But it's good information just to kind of consider, look at, make more sense once an individual is eligible, and maybe to the Medicare, this would come into play. For right now, it would be extra and maybe too much information. Representative payee, you'll hear this term. Now, a representative payee is required for an individual that cannot and is unable to receive their own funds and manage their own funds if that capacity is not there for the individual. And it could be because of treatments, it could be because of whatever barrier is not allowing the capacity for the individual to receive and manage their own funds, then a representative payee would be needed. The medical examiner during the process of the disability will determine, say, you know what, this individual is unable to manage their own funds. They will require a representative payee. Then that person, that individual with a disability that is receiving the benefit, will need to find a representative payee, or there are organization and groups that could be used by the individual to do so. And basically what it says is the benefit is going to go to the person, and that person that they designate as the representative payee will take care of all their Social Security needs. They can do all the changes, reporting, everything that is required. And that's what that representative payee should be doing. The individual receiving the benefit would only doesn't get the funds or the benefit directly. It goes to the representative payee, and they're responsible for paying and providing and using those funds appropriately. Within the representative payee, if a person says, well, I have power of attorney, it's excellent, but Social Security does not recognize power of attorney. The individual would have to become the representative payee to have access to do transactions or to receive their benefits for them. They'd have to go through that process. And while the individual is going through the disability process, which we talked about in part 1, can be lengthy, anywhere between 9 months and up to even 3 years to complete the process, depending on the appeals that maybe need to be done, and the continued applications or levels of application. Um, an advanced designation of a representative payee can be done for that individual, meaning while the process happens, so as soon as it occurs and I become eligible, then that individual will take over everything and oversee everything for the beneficiary. This is one of those areas where we talk about trust funds. It's called ABLE, Achieving a Better Life Experience. As you see there in 2014, this was established, which said, it was really targeting children with disabilities and these challenges, for parents that have money to be able to put money aside for their needs. And so it's very similar to like a college savings. It says we can save up to 100,000 for that individual without being affected. Now, they may not be able to receive benefits payment dollar, because there's monies that they could access if they needed. And this is what I was talking about earlier. The individual may just want to be covered in order to have the Medi-Cal or the Medicaid, right? To have that medical provision and have access to that program. And so that's what this ABLE account does for the individual. They can set monies aside and allows them to receive benefits. So there's a lot of things within SSI. As you can see, I try not to go too deep, but sometimes I get sucked up a little bit into that in explaining it. But that hopefully gives you an overall general idea of SSI. And so, Eli, I'll invite you back in. Thank you for allowing me to share the information, and we can go into the Q&A.
Yeah, that was a lot of meat on the bones, and I think one of the things that I've had to experience firsthand in helping my parents and stuff is like figuring out where to start with all of this, because it can be a maze going into the entitlement benefits and stuff. Is there any advice you would have for somebody getting started as to like who is a general person in their local community that they can turn to know where to just get started?
Yeah, this program, there are many organizations, social workers that are somewhat informed about supplemental security income. But I really would say if the individual is potentially eligible or considering, they really should just file and allow the Social Security claims representative or Social Security to kind of fill in the gaps for them, to get the
Okay.
information. Our website is a fantastic place for individuals to start. You can receive a lot of information there.
Okay. Thank you, Jeff. All right. So one of the other questions that came in is, can you qualify and apply for both SSI and disability at the same time?
And that's an excellent question. The short answer is yes. But in order
Okay.
for an individual to be eligible to SSI while having the entitled disability, would mean that the entitled disability is below, and as I said, it's right about a $900 threshold. If their
Mhm.
disability benefits would pay lower than that, then the difference would be supplemented through the SSI up to the SSI maximum, which right now I think is at 940, somewhere right around in there. It changes each year a little bit, and depending on some of the other factors that we have to consider, the live-in arrangements and all of that, to where that income would actually be. But yes, they could receive both. And again, the benefit in the long term may not be just the monetary side, but the medical side, because then they
Mm.
could be potentially eligible to Medicare after 2 years of the disability. Immediately, they're eligible to the SSI. So then they're eligible,
Okay.
or what we call that Medi-Medi.
Okay. And that's great that you brought up the 900, because somebody was asking too if you can expound on that and clarify about that $900 limit or that threshold.
Right. So the SSI actually is right at about 600 and some, and I don't have the exact number right in front of me, but it can easily be found on our website. That is the amount that comes from the federal for SSI. Each
Okay.
state has the ability to offer an additional amount. In the state of California, and that's where I'm getting this 900 from, is this additional $300, or that difference comes from the state of California for SSI individuals, bringing it up to that 900 and some. So it just is dependent. And that's why I kind of say around 900, we're talking for California, but you may be in a state where the state does not contribute any additional amount into the SSI. And I believe like Arizona, I don't think they offer any additional amount. So you would only have that 600 that comes from the federal.
Okay, understood. Okay, next question. I have private long-term disability insurance. Does this have any bearing on qualification for SSIDI?
Right. So the disability, the SSDI, the entitlement is not affected by long-term disabilities. The private insurances, you can receive that, and that's excluded. We don't count that income towards. For SSI, any income counts. So if the individual is receiving it, it would be considered unearned income. And if it's above that threshold, meaning we count it directly against what the individual is eligible, let's say $900, and they get 1,200 of this insurance, private insurance, then they would be offset completely, therefore zero or not entitled to SSI.
Okay. But then as soon as whatever like the long-term disability insurance would stop, then they could go ahead and reapply.
That is correct, Eli.
Okay. Okay, thank you for that. Um, Now, if I take SSID iPhones now, will that affect Social Security on benefits later?
If an individual is eligible to SSI, it wouldn't affect anything that they're eligible, meaning, let's say a retirement benefit, survivor benefit. But if the individual is eligible to SSI through a disability, the only way that they would not receive an entitled disability is if they had stopped working and they're not currently insured. So let's say the individual's 60 years old, they
Mhm.
worked up to age 50, and the disability progressively got worse, and then at age 60 they apply for SSI. They're not currently insured because there has to be 5 years of work within the last 10 to be eligible for the disability. So there
Sure.
wouldn't be an entitlement for that individual, but they could have the SSI. Then once the individual, what the SSI will require is as soon as the individual is eligible to any type of entitlement, which could start as early as age 62 under retirement, they would have to take
Uh-huh.
that amount reduced. If it pushes
Okay.
below again the SSI amount, then they're entitled to the difference. If the
Right.
reduced retirement is above the SSI amount, then they would stay with that benefit. The SSI goes away.
So there's a lot of if then type things that you have to see
Yes,
how
we could play
tailors
that
fit for
game
you.
all day long.
Yeah, and hence the reason why I was asking in the beginning, like, where does one navigate? Sometimes you have people that don't know how to read or just maybe not that educated and stuff, and they've gotten to that point of their life where they need this, but they don't know how to navigate it. Does that make sense?
Oh, yes, definitely. Unfortunately, that is often the case. And that's why, these types of forums are great. A place where someone can go back and watch a video on this. Um, and again, Social Security does the representatives we serve as a resource. So an individual can come to us and say, hey, I don't understand this fully. Can you give me some more information? Or there are partner organizations within the community that have received training through us or through another program and are aware of it and could help explain it to those individuals.
Exactly, and I think that's what some people are just simply going to need, just for the sake of being able to
Yeah.
understand it. But thank you for your expertise, and thank you for today's education with our patient community. We certainly need this type of aspect. Um, this webinar is going to be available in the next few days on YouTube and on this website, and we'll be able to transcribe the Q&A portion. We'll have that available as well. So sign up if you can for our e-news on social as well as through our website. If this information has been useful to you and you're interested in donating, you can do so at theopera.org/donate. And again, a special thanks to Progenics for making all of these webinar series possible through your educational grants. We really, really appreciate it. Thank you for everyone who attended today, and hopefully we'll see you next week for part 2 of this webinar series. Thanks.